Good afternoon. I'm Alan Unell, and this series of videos is called Healthcare Advocacy, where we address problems in the healthcare system and try to take actions to make a better system for all of us. We have a lot of topics today, including insurance fraud, not the way you think. But before we get to it, let me point out down below in the YouTube description box is the link to the Healthcare Advocacy newsletter, and that newsletter is the text for today's video. It also contains all the actions and background material and studies, everything, every reference I have for today's talk in the newsletter. You can subscribe there for free and get them delivered to your inbox. Okay, let's get started. First, I want to talk about insurance company fraud. It's not people cheating the insurance company, it's the insurance company doing the cheating. We're going to talk about Humana, and I'll tell you, before I get to the text, let me tell you that this is a particularly egregious suit. Humana has now agreed to pay $90 million, not a small fine, to settle a whistleblower lawsuit by one of its former actuaries. If you're not familiar with what an actuary does, they're a statistician who helps insurance companies set rates appropriately based on the observed or projected risk that they may face. Anyway, it accused the health insurer of overcharging the U.S. government for prescription drugs. The whistleblower's lawyers announced last week. The whistleblower, whose name is Stephen Scott, said that Humana, which contracts with the federal Medicare program to administer prescription drug benefits, misrepresented its true cost in order to get a more lucrative contract. It's so shady. Anyway, this is the first settlement of its kind with any insurer over allegations of fraud tied to Medicare's prescription drug contracting process, according to the law firm Phillips & Cohn, which represented the whistleblower Scott. Let me talk about childhood vaccines. It's August of 2024. School is going to start pretty soon, so it's time to make sure everybody's up to date on that vaccine list, children and adults. So, doctors are urging parents to make sure that children's routine vaccines are up to date before the first day of school. Children should begin vaccinations against 15 potentially serious diseases before they turn 2, according to the Center for Disease Control and Prevention. And you know what? This includes annual shots against influenza and COVID-19. There's a link to a story about this in USA Today. You can find it in the newsletter. Now, kids receive most of their shots during routine checkups, but doctors say that some pediatric patients are still behind because of the pandemic, which interrupted a lot of wellness visits. Physicians encourage parents to make sure their children are up to date on their shots before they head to class. Now, the Vaccines for Children program, and there's a link to that program in the newsletter, has brought about a record increase in vaccinations since it was established about 30 years ago in 1994. But the pandemic really did inhibit some of that progress. Most vaccines are delivered in multiple doses on a schedule. They protect against diseases like hepatitis B, rotavirus, diphtheria, pertussis, that's whooping cough, tetanus, lockjaw, Haemophilus influenza type B, that's called HIV, pneumococcal disease, oh, make sure you get that. Polio, oh, please get a shot for polio. Measles, mumps, rubella, chickenpox, and hepatitis A. Now, vaccines are sometimes lumped together in a single vial, making it possible to protect against multiple viruses in a single shot. For instance, children only need one series of doses to protect against measles, mumps, and rubella, MMR, and diphtheria, tetanus, pertussis. Those are two groups of shots. Those are targeted jointly in a single series of shots. Anyway, let me tell you why this is really important. There have been recent outbreaks of measles in the United States. It is highly transmissible. It can be prevented with vaccines. And they demonstrate the importance of a high vaccination coverage. For every 10,000 infected children with measles, get this, 2,000 are hospitalized. 1,000 develop ear infections with the potential for permanent hearing loss. 500 get pneumonia, and 10 to 30 will die. This is from the Dean of the National School of Tropical Medicine at the Baylor College of Medicine. That's according to a report by NBC in the newsletter. Now look, there have been at least 13 measles outbreaks in 2024, according to the CDC, including one that occurred earlier this year in a Florida elementary school. Of the 219 cases reported this year, 40% were in children younger than 5, 80% were among adults and children who were unvaccinated or could not demonstrate they had been vaccinated. Childhood vaccinations are typically mandated for public school attendance. They're not always required for private school, and many localities offer waivers for a variety of reasons, like religious objection. Of course, thanks to wide disinformation campaigns, many parents are hesitant to vaccinate. Don't be hesitant. I've included a link in the newsletter to the CDC list of vaccinations that are recommended by age. If you go to the webpage, you just click on the age range and it'll tell you what the child needs. They go, to get the full schedule, they go 0 to 6. Oh, I'm sorry, there's also another CDC page that breaks them out slightly differently in the age range 0 to 6 and then older. And they're on a timeline schedule so you can see when they're needed. And of course, don't forget COVID, flu, and RSV. Just get the vaccines. Okay, let's talk about profits and patients and what happens when they collide. We have covered private equity investments in healthcare, and it rarely results in an improvement for the patient. Techniques are employed that typically involve short staffing, cutting back on the staff so they don't need so many people spending time with patients, breaking the facility into separate paying companies or cost centers, and making sure that the hospital or medical facility has to pay each of those profit centers. For instance, you might have a profit center that is the MRI center, or you might have a profit center that's the emergency department, or you might have one that's OBGYN. Anyway, they also front load the facility with debt, and they take the money, a lot of the money from that newly incurred debt, as well as money they make from these other shenanigans, goes to pay investors really quickly. They make a lot more money on this than they do in the stock market. Anyway, these techniques work pretty well to squeeze out high dividends to investors really fast. Of course, you don't have to be a private equity fund to do this. Many of these same techniques are employed by publicly traded for-profit companies like HCA. Let me take a brief step away from the text and remind you that HCA in the late 80s and early 90s was headed up by a fellow named Rick Scott. Yes, it's that Rick Scott who was the governor of Florida and is currently a senator. They were responsible for, at the time, the largest Medicare-Medicaid fraud against the United States government. They had to pay in criminal and civil penalties over $2 billion back to the U.S. Back to our story. There is a new working draft study out of Wake Forest University. It is the most comprehensive analysis of the personnel crisis that's occurring at Mission Hospital in North Carolina to date. It uses hundreds of interviews, documents, and media reports to tell the story of a mass exodus of doctors, a poor working environment for nurses, and a dangerous situation for patients, all brought on by the profit-centered management at HCA. I have a link in the newsletter. You can go read the report. It's a 49-page report titled Changes in Patient Care Following HCA's Purchase of Mission Hospital. And there's an accompanying 30-page index of sources that comprise the first academic summary of Mission's staffing tumult since HCA bought Mission in 2019 for $1.5 billion. They don't do it for largesse. They're doing it to squeeze the money out. Anyway, the report is written by Professor Mark Hall. He's an independent academic researcher and a member of the National Academy of Medicine. that should mean something. The National Academy of Medicine is chartered by it's a private company like an FFRDC, chartered by the United States government to provide analysis to support the government and all of us. Anyway, he reached 3 big conclusions about what happened at the purchase, so just listen. Doctors left Mission because of quality of care and financial issues and have been replaced by less experienced staff. Today, some of the specialties are severely depleted or gone, including ear, nose, and throat, urology, rheumatology, orthopedics, and neurology. HCA's management slashed staffing among nurses and other personnel vital to patient care. Understaffing has caused a multifaceted debacle in Mission's emergency department, one that in 2024, it was so bad, it drew federal scrutiny, and they threatened to just halt Medicare and Medicaid funding to the hospital because they could not care for patients. These adverse developments have been driven by HCA's financially focused management decisions, which have been enabled by Mission's market position as the only hospital in the largest county and the only tertiary care hospital in all of Western North Carolina. Deep breath. When the patient is the vehicle for profit, the patient suffers. We can ask Congress to change the rules so patients are treated more fairly. The legislation that we should ask for should prohibit hospitals that take federal funds putting patients at risk while they squeeze out the profits. They should also have to create an escrow account with enough money in it to cover 5 years of operations so they can't just close and leave the patients high and dry. Imagine what would happen if Mission Hospital was forced to close. You would have no hospitals in Northwest North Carolina. None. So if you're injured, you're dead. Okay, let's ask Congress to take action. Let's ask our members of Congress and senators to help repair the situation, but it's complicated. We have to let them know that patients are hurt when profits are more important than patient outcomes. We need legislation that stops management short-staffing and eliminates care or functions at patient expense. They should also set up that escrow account I mentioned. You can reach your representatives at the link that I'm going to put in the YouTube description box, or you can use my favorite tool, ResistBot, and all you have to do is send a text message from your cell phone to 50409, and here's the message. Sign, S-I-G-N, space, PJUQZK. Sign, space, PJUQZK to 50409. I'll read you the message really quick. I'm your constituent, and I want you to know that HCA Healthcare, one of the biggest for-profit hospital operators, is busy squeezing money out of one of their recent purchases, Mission Hospital in North Carolina, at patient expense. And I include a link to the report so they can read, or their legislative staff can go and read and see how bad it is. I bring up this problem for a reason. While making a profit is fine, this company is following some of the same techniques that private equity firms use when they buy medical facilities and squeeze them dry. The bottom line is that patients suffer. I want you to have a look at the Health Over Wealth Act in Congress. It's both in the House and the Senate. Modify it so that it applies to any commercial entity that purchases a healthcare facility or hospital. It demands the escrow account with sufficient funds to operate for 5 years in the event of financial problems for this facility to help protect patients. It prohibits shady real estate transactions that bleed these new healthcare facilities dry. It prohibits stripping out assets to reap profits while patients suffer. You should think about eliminating staff and leaving patients untreated. I know this is an awful lot to ask, but this is one of the ways hospitals are forced to close. When they're captured by for-profit ventures that squeeze out every nickel and then declare bankruptcy. I'm going to put a link in the email to Senator Markey and Representative Jayapal's Health Over Wealth Act for reference so they know what they're looking at so that they can hopefully put forward legislation to make the change. And then we, of course, say take action on this. Okay, look, that's what I've got for you today. It's not a pretty story. Down below, link, share, subscribe. You can leave me a comment. I will get back to you as fast as I can. You can send me comments also at healthcareadvocacy1@gmail.com. Thanks. Have a good day.